Good wound care in disaster setting will be reduce mortality and morbidity caused by infected wounds. Good day, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. We are really grateful and thanks to the President, Ms. Gulnas, and all the committee for this opportunity to do discussion in this prestigious conference. I will deliver my topic, 7-Step Disaster Wound Management. My name is Wida Srigitarja, work as a clinical nurse WOC specialist and the advisor of INWCCA that concern in advocacy for disaster wound management. And this is my COI declaration of my presentation and also the outline of our discussion today. We would love to introduction about wound care in Indonesia. Indonesian wound care services have been set up for more than 20 years already since 1995. Wocare Indonesia was started in 2007 as a first NGO that was concerned with education and research projects program. There is a collaboration between physicians, surgeons, ETs, clients, and family to promote the quality of life and mutual help among clients and healthcare providers. This is a distribution of the students who complete the program. They are members of INWCCA. It's already around 20,000 members. So that's why we are concerned in wound disaster management in Indonesia. As we know, the risk for injury during and after disaster is high. The powerful earthquake again rocked Indonesia in several times. Newspaper reported that less than 1 minute, a lot of people injured. This is the latest situation of disaster report in 2021 that around 12,000 people injured after earthquake and some of disaster in Indonesia. A few of journals also concerned about wound management in disaster situation. And the summary that we have recorded explain the high rates of wound infection because of inadequately wound care management. Good wound care in disaster setting will be reduced mortality and morbidity caused by infected wounds. All wound clinicians interested in disaster volunteering should take a course in mass casualty or disaster preparedness. Wound clinicians should gain experience in team building by joining multidisciplinary teams within their clinical sites. This is the graphic number of between deaths and injuries people that we have summarized in naturally occurring and man-made disaster situation. Wounds are a major source of morbidity and mortality. The high rates of infection occurred from contamination, tissue loss, inadequate or delayed wound cleaning, and also debridement and premature wound closures. According that, we are concerned that in disaster situation, we found there is a lack of emergency resources for wound management. Actually, the healthcare providers must understand that the wound healing has progressed from inflammatory to the other phase only in 3 to 5 days. So the early manageable in wound care management will help wound reduce from risk of the infection. These were the disaster experiences that the Indonesian Wound Care Clinician Association teams since 2016 and 2021 that in PD Jaya, Aceh, Sinabung, Prolak, Lombok, Palu, Sigi, Gondala, Parigi, Mutong, Banten, Samarinda, Jakarta, and Mamuju, Majene. The experience of disaster has led us to many cycle strategies concept for handling that. The provision for effective, safe, and clinically competent of wound care will continue to be priority. So the strategy project of disaster wound management, including the 7-step disaster wound management, that the strategy project following all these steps. So when the earthquake is done, what is the preparation we must do? This is the big question we always ask to the teams. During the earthquake and immediately after, wound clinician, including the leader and his team, have to preparedness tools and strategies. How to respond to emergencies and following step is described what to do to help in the wound care management. Actually, the 7-step disaster wound management are the critical thinking to do wound care. This is the framework based on 7 steps of care plan that wound care clinician can do the dressing procedure that develop from the 4 phases of a disaster situation. The red one is the risk emergency situation. The yellow one is the preparation plan and wound care management. The green one is the evaluation. The 4th one, the blue one, is the collaborations. At the first situations, the red ones, the clinician need to be aware of and understand the emergency situations by conducting a primary survey. Assessment of life and moving the patient away from any hazard are a priority. ABC is a priority. If they found any bleeding, needs to be stopped by applying direct pressure or using of the tourniquet. In the second situations, it's a preparation plan and wound care management. Actually, is the implementation for the wound care management. It is important to understand the basic of wound management by following all the steps. So, such as how to dress the wounds. So we make use to simple dressing models. We have a 3-step of method approach, including managing wound cleansing, method of wound bed preparation, and managing of use appropriate wound dressing. We call 3M. This is the procedures, looks like how to dress the simple dressing model. We are so proud when we found that the clinician following the step incorrect. This is the simple dressing for burn patient in a disaster in NTB. The third situation is the evaluation after 48 and 72 hours. This is the follow-up crucial for patient health to minimize safety and liability concerns. We know that chronic wounds are often heavily contaminated and colonized, which can increase the risk of the infection. When we found the infected wound, so we must do for the 4th situation. The 4th situation is collaboration. Code G is a call for multidisciplinary collaboration if the wound is getting worse and infected. Reaching out the working with the allied healthcare professionals from the multidisciplinary team is a very essential in looking after people affected by a disaster. Last but not least, the wound clinician must be documented their implementation as a proper documented. Health record, very accurate, valid date, readable, authenticated by the NWCCA, and we have a same terminology using the time concept. And the reflective of wound care process, they will write down the 7-step disaster wound management. It's A, B, C, D, E, F. Other situation that we also concern is a psychosocial aspect. Disaster situation needs information regarding their illness management of pain and their symptoms. Sufficient information is a prerequisite for the patient to participate in care, improve patient adherence, and facilitate patient coping. So that's all the strategy projects that we have done doing in 9 disasters in Indonesia. So this some of the greatest picture of the NWCCA teams that they have done their project in disaster. These are the organization of the team structure. This is the president, Mr. Edi Mulyadi. And this is we have donation from healthcare product national and international through InWCCA for disaster. We have kind of base camp that the team of NWCCA can stay and doing preparedness before visit to the hospital and the home care. This is the base camp at the nursing private practice that we mentioned before. We have 400 private practice around Indonesia. This is the base camp at the public healthcare services under Ministry of Health. They're doing the outpatient clinic. And also this is the military base camp and the team doing the wound dressing. At the community services, the team doing the dressing change is a very challenging situation. They can do in the ambulance and also can do in the truck. And we also do the visit hospital to see the wound care that we refer after Code G for the multidisciplinary team, or we found the infected condition after the surgery. This is the situation was in Palu that had a 7.2 Richter scale. The team get morning report from Ministry of Health District about the patient condition. It is a burn. They were preparing visit program for the wound care management. We also found or get information report from community direct to base camp clinic. This is the patient before disaster. They have a suffer fracture in 1 month and stuck at the home when the disaster happened. So to prevent the infection, we do the debridement, doing the autolysis debridement and conservative sharp wound debridement immediately. So that's why infected could be reduced. This is other chronic wound in the great locations. It means in the neck, and we do the prepare wound bed preparations by doing autolysis and conservative sharp wound debridement. So we get the granulation tissue in a wound bed. Other cases, such as a wound cancer patient and pediatric stoma, is also found in disaster situations. Pain is most common, especially in burn patient in disaster. This baby, 4 years old, 3 days after disaster, comes to the base camp because of mother boiled water for cooked noodles. And this is the result after we dressings, and it is a happy, is a part of the story when we have a result of the wound is healed properly. So what we have learned in this project, that we have done 765 cases from 2016 and to 2021, reflected in 9 disaster, following 9 disasters in Indonesia. We have injured people by home visit and sending dedicated wound care clinician to the hospital to prepare the wound care. So we read down in the Asian Wound Journal. So we found that the summary of the projects, first is a disaster wound situation could be managed with the basic wound management on promoting optimal wound healing was the first objective that may be achieved through 7-step disaster wound management. It is very simple and very useful. In addition to education in preparing the students in the event of disaster, education in emergencies and reconstruction of wound care management is equally important. Healthcare professionals and providers have been widely as a part of national, regional, and international projects and initiatives about managing disasters. Remember that disaster situation is not easier than we could imagine, and sometimes a series of events of disaster that suddenly disturb everything. Safe and effective early management of wounds by first responder in a disaster setting can prevent complication and save lives and lives. Thank you very much. This is our acknowledgement to express our special thanks of gratitude to the WUWHA's committee and Wocare management who gave us the great opportunity to do this wonderful project. With a special thanks to Asian Wound Council, Malaysian Wound Care Professional, WCT World Council of Enterostomal Therapy, ISTN, and advisor of Indonesian ADNEP and the Indonesian Ministry of Health, we are really thankful for that. This is our reference, and thank you very much for discussions today.
Dance like there's no tomorrow.